Good evening, everyone. Hello and welcome to this Mile End Institute webinar hosted by Queen Mary University of London. My name is Patrick Diamond. I'm the director of the Mile End Institute, and we're absolutely delighted to have you with us this evening for a panel discussion which is taking place around a new book published by Hilary Cooper and Simon Szreter, which is entitled After the Virus: Lessons from the Past for a Better Future. There's two reasons why we were particularly keen to host this session tonight. One is that we felt that there was a dearth of really good books which have been published to try to understand the broader policy implications of the COVID-19 pandemic. And we think that this book really fills a void or a gap in the literature around how we can learn from the experience of the pandemic from a public policy perspective. I think, as no doubt Hilary and Simon will say, it's important also to make clear that Hilary and Simon are not implying that the COVID pandemic is over. Rather, what they're arguing is that the book, through the book, is that we need a different kind of policy settlement that comes after COVID and really tries to learn the lessons from an economic and social policy perspective. So for these reasons, we're just delighted to be able to host this session and to learn more from Hilary and Simon about the book, their thinking, their ideas, and so on. The way that the session will work is that Simon and Hilary will introduce the key themes of their book, and then we'll ask Sophie Harmon and Dan Corrie, who I'll introduce later in the session, to give a response. There will then be an opportunity for questions and comments from the audience. You can put these in the chat box or use the Q&A function, and you can also tweet using the hashtag @MileEndInstitute. So without further ado, I'm going to hand over to Simon Szreter, who is Professor of History and Public Policy at the University of Cambridge, co-author of After the Virus. He's going to kick us off this evening and introduce the core themes of the book. So Simon, it's a pleasure. Over to you.
Thank you very much, Patrick. Delighted to be invited by the Mile End Institute to discuss the book. So what we're doing in After the Virus is we're focusing on what history can teach us, rather than on, I think, what is very common in the political and social science world is to look at other countries around the world and to say, oh, look what they're doing, can't we do that? And we're saying, well, we do have a lot of really significant resources in our own history that we need to think very carefully about. And of course, our own history is very intimately linked to who and what we are today, both as a society and our institutions. You know, we've inherited them. We have to work with them. They're what we've got. So our aim is to look into history to illuminate a strategy for the future. And as we face multiple global challenges, of which we think COVID-19 has been really the big shot across our bows that we must take seriously. Very obviously, climate change, etc., is coming our way. So After the Virus, I think we look at history in two ways, principally. Firstly, we look at the last 40 years, what historians would call, very recent history. In fact, when I started being an undergraduate historian, you wouldn't even count the last 40 years as history. That was, strictly speaking, off limits. But now history's really kind of got down and dirty. So we're going to look at the last 40 years, and we ask, why was our society so lacking in resilience when COVID hit? And I think to answer that question, it's the last 40 years and even the last 10 that are crucial. But we're also wanting to go back much further to show there are things about our long-term history that are extremely important in thinking about our future. Now, history, one of the delights of teaching and researching history is the surprises that it throws up at us, things that we had forgotten or and didn't know, and this can change very significantly the way we think about ourselves. So the big surprise that we're foregrounding in this book is that Britain, well known for having the first industrial revolution in the world, but unknown amongst all but specialist early modern historians for having the first welfare state in the world. And I'm not talking about William Beveridge and the mid-20th century. I'm actually talking about Elizabeth I and her Poor Law Acts of 1598 and 1601. These were absolutely extraordinary acts. They were innovative globally. They were groundbreaking. To put it in a nutshell, we're short of time. From 1601, it was illegal to allow any subject of the crown to starve anywhere in the country. No other country had produced such an extraordinary mandate. Now, it wasn't just also that this was a piece of paper that Elizabeth I flourished and signed off, and we can find it in an archive. We now have lots and lots of very important monographic history from my colleagues demonstrating that this law really had legs. It really went into action. It was implemented, and we can demonstrate that in a number of ways. We can show that it grows in its extent of coverage, and by the time of its peak, around the time of the Napoleonic Wars, there's enough income being collected to support 5% of the entire population for an entire year. Now, that by early modern standards, that's extraordinary. That is something that no other state is able to do. So the crucial first lesson of history is welfare states are not a modern democratic creation only. They are not simply a luxury that we have given ourselves in the modern world, and that therefore when times are hard, George Osborne can say, oh, we can cut this all back, it's kind of fat. It's not going to affect the economy. It's a bit of a shame, but we can, it's just a luxury. So history suggests that in Britain's history, which was the leading economic nation over the course of the next few centuries after Elizabeth I's acts, that the welfare state is much more fundamental to economic productivity as well as to society. So this leads into the fact that not only was our welfare state essential, we argue, for Britain's subsequent industrial revolution, it was also facilitating a dynamic and a nurturing society. And we say that what England created at this time was something we call collectivist individualism. Now, these are two terms which in the modern political philosophical lexicon are viewed as opposites often, that they can't meet, and certainly they're often simplified, that collectivism means, oh, you're a socialist, oh, you believe in planning and communism and so on, oh, you're an individualist, you believe in the free market, and so on. So they get polarized. And what we're saying is, of course, you can make those arguments in logic, in philosophy, given the words. But when we study history and the way that real societies have functioned over centuries, not just now and then, collectivist individualism is best characterizes our society for not, for one period of 200 years or more, and then again for a second period after World War II. In between, we went into something else. So there are two key periods in our history when we've had collectivist individualism, and it has been good for our productivity, it's been good for social mobility and for growth. So what was the Elizabethan Poor Law? Briefly, it was a compulsory progressive taxation system on wealth. It taxed the value of occupied land. Land was the main source of wealth before the Industrial Revolution. It's highly devolved. There were 10,000 parishes in England and Wales. The new post-Henry VIII Reformation Church, it's got 10,000 parishes. Think of it like 10,000 mini welfare states that are being created in 1601. They've each got to raise a fund, a progressively taxed fund. They have poor law overseers to administer both the taking in of the money and the handing out of the money to the ill and the poor. And it's all overseen by a justice system. England already has a network of justices of the peace, and it also has circuit judges, high court judges who monitor the circuit. So you've got justices of the peace monitoring and auditing the parishes, and you've got high court judges monitoring the justices of the peace. So you've got a really good accountability system built in, and it's all black letter law. It's statute law, taken very seriously by justices of the peace, and particularly by the high court judges. And we've got that's generated a lot of the evidence that enables us as historians to know that this system really existed. It's actually the appeals and so on that historians are able to study and to show how the system's operating. So what it does with this money is it collects, every parish must have this fund. It's collected yearly, well, it's collected monthly often. The money is dealt out on a day-to-day, week-to-week basis to, and these are in the statutes, to orphans, to what's generally called, the general category is the impotent poor. The impotent poor meaning those who cannot look after themselves, and that is in the statutes embraced as orphans, the ill, the disabled, the elderly, and most importantly of all, the involuntarily unemployed. Because previously there had been a general notion that unemployed, especially if they were young men, were kind of lazy vagabonds was the word. They were to be punished. But these laws, after 50 years of hardship in the late Elizabethan period, these laws are recognizing that the intellectuals of the period are acknowledging that there is something which we today would call involuntarily unemployment, and that these people, even though they may be fit young men, they need to be supported if necessary. So the whole population is guaranteed food security. This is an extraordinary achievement, and it's one of the reasons why we can demonstrate that this system really existed. Demographic historians are able to correlate death rates in our country right back to the 1530s when the parish register system begins, with the prices of grain from year to year. And all across Europe, you always see, for hundreds of years, you see grain price hikes being correlated with mortality spikes, either in the year of the dearth, as it was called, or the year following. It's happening all over Europe. It's just it's a fact of life. The harvest is not secure. In England, the last time we see a famine affecting a significant part of the country is 1623-4. That's over 150 years earlier than anywhere else in Europe. So the English population is benefiting from a form of ontological security, food security, which of course we can't even guarantee in our world today. We have bloody food banks in our country. We have regions of the world like Yemen and so on that can't, I mean, it's just tragic. But, 400 years, 300 years ago, this country was able to devise a system that guaranteed food security, even in the hardest of times, when the prices went up, when the harvest had failed. But that's not all the Poor Law does. It also facilitates labor mobility. This is something that Adam Smith, very brilliant man, got many things right about the economy of his time, but he got this totally wrong. He was living in Scotland. He didn't really understand, I think, how the Poor Law worked. He thought that it impeded labor mobility. We have now stacks of studies to demonstrate completely the opposite, and we understand why. Why would this system help labor mobility? And there are two principal reasons. One is that one of the major reasons why the younger generation in early modern Europe were shy of going to search for work in other places was the fear of the elder generation of what's going to happen to us when you're gone. But the parish poor law is very clear that your elderly parents are not going to be left to die when they're ill or whatever. The parish looks after them. So as a younger generation person, you have no guilt, you have no problem to go and seek your fortune. Secondly, when you do go and seek your fortune, if it doesn't work out for you, the poor law picks you up. It doesn't necessarily provide you with support in the town or village that you've ended up at, but it is up to the poor law authorities to take you back to the town you came from so that you do not starve at their expense. So this is to that extent, it's a national network of support. Another piece of really important proof of how this is working, completely contrary to what Adam Smith thought, we now know that England's rate of urbanization between 1600 and 1800 is absolutely stratospheric. England's rate of urbanization across those 200 years is 350%. So that's the proportion of the population living in towns of more than 5,000 population increases 3.5 times. The comparison with anywhere else in Europe, including Holland, which is the leading economy of the time in 1600, no other place in Europe manages more than 25% increase in its urbanization. I mean, this is just, you know, this is really the heart and the soul of why England's economic growth is so precocious and why it leads in eventually to the Industrial Revolution when steam engines are discovered. But England already before the steam engines has had the most extraordinary division of labor, because of course it's living life in towns that produces this. I think I'm probably well over time, am I? Is that right? I better, okay, I'll try and cut quickly. I've got too excited. So I think the second period is 1945 to 73 and the post-war decades. So after all the troubles of the interwar, we get the welfare state, the modern one. In between 1834 and 1945, we had no welfare state. In 1834, the Elizabethan Poor Laws were redacted. We had something called the New Poor Law. That's the era of the workhouses, the Dickensian workhouses. And that lasts from 1834, more or less, until the First World War. We do get, just before the First World War, old age pensions brought in and so on. There is some rowing back on the 1834 principles of the free market and homo economicus, which is basically the thinking behind 1834. But when after 1945, we get the new welfare state, that's a reaction to all the troubles of the interwar period and so on. And another thing that doesn't seem to be very well signposted and discussed is that 1951 to 73 is the highest rates of productivity growth in our country's history. 2.4% per annum productivity growth in those 24 years. And that is higher than we achieved even in the Industrial Revolution. And it's higher than we have achieved subsequently with all the free market privatization changes. And the most amazing thing about the 1951 to 73 productivity figures are that they were achieved with full employment. It's quite hard to achieve such incredible productivity figures with full employment. In the Thatcherite and Major period, there were a few years when we got close to 2.4%, but that was with 2 million or more unemployed. In other words, the least productive part of the workforce was out of the equation. So this was quite an achievement. So finally, conclusions are that collectivism and individualism, history says they are not opposites, and that we have been at our greatest in terms of social cohesion and productivity when we put the two together institutionally in the design of our society. And that a facilitating and nurturing welfare state has contributed to our economic productivity. It's not a cost or a luxury on the economy. It's actually a major contributor. This happened in two key periods of our history. One very long one, 1600 through to 1834, and then we revitalized it after the Second World War. Okay, and now I'll turn over to Hilary. Sorry for getting carried away.
Not at all. Thanks so much, Simon. I'm going to hand directly then over to Hilary Cooper, who is a former senior economist in UK government, policymaker, obviously the co-author of the book. So Hilary, over to you. Welcome.
Thank you very much. Okay, I want to begin by reflecting on Rishi Sunak's budget on the 27th of October, which was widely reported to have increased the size of the state its spending as a percent of GDP to levels reminiscent of the 1970s, while also upping the tax take to its highest level as a percentage of GDP since the 1950s. Now, even before he sat down, Sunak had expressed his clear unease with that and began setting out his aspiration to be cutting taxes by the end of the Parliament, talking about the moral dimension to the challenges he faced and stating his future intention to revert to a smaller state. And that echoed his language a year earlier when he had said that the government had a sacred duty to balance the books. So what Sunak was trying to do was to pass off as self-evident the supposed truth, the moral imperative that a larger state should necessarily be considered a bad thing. And it actually reminded me of when I was in New York during Obama's campaign for re-election in 2012. I would see Republican politicians taking to the stage and asking rhetorically, did people really want a healthcare system like the ones in Europe? And I would be sitting there thinking, well, yes, before realizing that the point of the question was that it went without saying that that was the one thing we couldn't possibly want. Now, it's true that for the moment, Rishi Sunak has halted austerity, but in every area apart from health, he hasn't reversed it. And in many cases, especially local government, he hasn't even restored spending to where it was in 2010. So the neoliberal commitment to shrinking the public sphere, the Washington consensus that has dominated thinking in the UK and the USA since 1979, still casts its shadow. But as we set out in our book, it was that ideology that was ramped up by the austerity of the last 10 years that had left us with so little resilience when COVID-19 hit. Now, COVID-19 was not the unpredictable black swan, the once in 100 years event that some liked to claim. There had been plenty of warning of what was to come. And we now know from documents that were leaked in 2020 that a pandemic had for years been the top red risk on the UK's National Security Risk Register, which was a document signed off each year by the government chief scientific advisor. So planning and stress testing for that had actually been routine up to 2016, which was the year of the last major rehearsal, exercise sickness. And that exercise found major deficiencies in our preparedness, including our stocks of PPE and, ominously, the resilience of the care sector. But it was not acted on. After that exercise, political attention and resources were increasingly diverted away from pandemic resilience because, of course, by then we'd had the Brexit vote, and resources began to be diverted to planning for Brexit, including, as time went on, the possibility of a no-deal withdrawal from the EU. And so unfocused was the government that even in early 2020, Boris Johnson was sufficiently cavalier about the approach of COVID-19 that he missed all 5 of the COBRA emergency planning meetings in January and February of that year. But it wasn't just this ineffective government and inadequate planning that had left us on the back foot. The cuts in public services made during the decade of austerity had also left us peculiarly vulnerable to a shock like COVID. So first of all, NHS bed capacity had been cut by over 30,000 beds, and that's 1 in 6, so that we had no provision, no slack to respond in any kind of emergency. It was doubtful whether we could even cope with a normal year. Stockpiles of PPE had been run down against expert advice, which was to build them up, so that for weeks into the pandemic, health and care staff were working without adequate protection, and some, as we know, were paying for that with their lives. Less well known is that our 100-year-old pioneering public health capability had been so depleted that contact tracing of those with COVID was actually abandoned in the middle of March 2020 because the capacity was just not there to deal with the rising numbers. And the panicked response to that, to create from scratch a privatized service known as NHS Test and Trace, was not operational until late May. And as we now know, Test and Trace has spent £37 billion of public money without actually achieving its core objectives. So you could conclude that we couldn't have made our population more vulnerable to the shock of an event like COVID-19 if we tried. Having removed so many NHS beds, in March and April 2020, 25,000 elderly patients had to be precipitously discharged from hospital into care homes to free up that capacity that the NHS had lost. But that was accompanied with an instruction that negative COVID tests were not required. And the ensuing toll in terms of care home deaths in April and May 2020, which ran into the tens of thousands, was one of the scandals of our pandemic response. But there were more insidious issues. The gig economy and the increasing casualisation of the workforce meant that large numbers of frontline and key workers, such as taxi and delivery drivers or agency care staff, were left without adequate or in many cases any sick pay entitlement. Most also had no savings to fall back on after years of wage stagnation, and they were in precarious jobs that they could not risk taking time off from. So the result was that many were working when they were sick, and they were risking spreading COVID among their co-workers, but also among their families and their communities. And it's no coincidence in the light of this that the death rate from COVID turned out to be twice as high in the most deprived fifth of the population as it was in the least deprived fifth, the least deprived being those who had the luxury of being able to work from home, to isolate if they needed to, and to take sick leave with pay. Failures in the way the pandemic was managed during 2020 further amplified its impact on health and the economy. Precious little action was taken to control our borders, to stop large public events going ahead in March 2020, contrast with other countries. And lockdowns were dangerously delayed both in the spring of 2020, but astonishingly again in the autumn of that year. And the Office of Budget Responsibilities report, which they published in March 2021, noted that the UK had suffered the biggest contraction in economic activity of all of the major economies in 2020, a 10% contraction. And this, they said, was because high rates of infection and hospitalisation in the UK had forced us into much longer periods of lockdown than would have been needed had the government acted decisively to bring in restrictions early on. So perhaps we should now be wondering why recreating an era of active government and high public service investment is so self-evidently unattractive. Of course, we don't want to go back to the twin tubs and the Morris miners of the 1950s, but as Simon has said, there's a lot about that post-war era that we could learn from. And interestingly, as early as April 2020, the Financial Times published an editorial that began to move towards exactly that insight. So they argued, in the light of our shockingly low resilience to COVID's impact, that radical reforms, reversing the policy direction of the last 4 decades, will need to be put on the table. Governments will have to accept a more active role in the economy. They must see public services as investments rather than liabilities and look for ways to make labour markets less insecure. Redistribution will again be on the agenda, the privileges of the elderly and wealthy in question. Policies until recently considered eccentric, such as basic income and wealth taxes, will have to be in the mix. So in the narrative about returning to 1950s levels of taxation, which we began with, the point that tends to be missed is that taxation in the 1950s was also highly progressive. By contrast, Sunak's recent tax hikes have frozen personal tax thresholds for ordinary workers, have pushed up national insurance, which is a tax on earned income, but have left wealth taxed at a much lower rate than income is taxed. And of course, as we know, council tax remains regressive and unreformed. Now, child poverty doubled during the 1980s, rising from 15% to over 30%. It fell back somewhat under New Labour, but it's now gone back to levels above 30% as a result of policies of austerity. Contrast that increasing poverty with the growth in private wealth, the wealth mountains that we've built up. Private wealth has risen since the 1970s from 3 times the size of our national income to 7 times its size today. And as Torsten Bell, Chief Executive of the Resolution Foundation, has pointed out, while wealth has grown much faster than income in recent decades, wealth taxes have not risen at all and are riddled with problems. This, he says, is not a situation a post-virus Britain can afford. Sunak could already have acted on this in his October budget. Simply aligning the taxation of capital and income would have raised really significant amounts of revenue. And it is actually something that the Office for Tax Simplification had already recommended that he should do. So our book concludes by arguing that we need to revive our historic inheritance of collectivist individualism, as we did so successfully after the Second World War. This would be to create a genuinely empowering society to replace the neoliberalism that continues to disempower so many people. And as we set out in the book, we see this empowering society as being built on 7 core pillars. The first, a nurturing state, requires us to support and invest in the population, firstly by reforming the benefit system and embedding guarantees within that over minimum income. But as a welfare state, it would also invest in the health and educational catch-up needed post-COVID and ensure that the needs of an aging population for health and crucially social care are provided for in a reinvigorated welfare state that would also capture childcare within it. So taking its lead from the Elizabethan and post-war welfare states, this would be supported by grasping the nettle of fair and progressive tax contributions, another of our pillars, with a particular emphasis on that wealth taxation. A third pillar, ethical capitalism, would see new laws to change the way businesses are run, making it a duty in the future to promote the long-term success of a business so that they create value for society, rather than, as at present, all too often extracting value for short-term shareholder gratification and frequently offshoring. All of this must be supported by a renewal of democratic discourse and citizen participation that can counteract today's cronyism and corruption. Local government must be empowered and properly resourced, and communities and young people need to have their voices heard through greater use of citizens' assemblies, for instance, and we argue for an extension of the vote to all those aged 15 and over, the school children who have been so active out on the streets campaigning for their future. And our final 2 pillars relate to that future, arguing for us to live within our environmental limits and to seek to do that by refocusing our measures of success onto appropriate and sustainable goals, and to stop the elusive chasing after goals that simply emphasize ever higher growth. So COVID-19 was almost certainly just the dress rehearsal for the rest of this century's challenges. We need to redress both climate change and rising inequality. And if we're going to learn anything from what we've been through, it is that now is the time to leave behind the learned helplessness of the neoliberal state and commit to a new morality of collective support.
Well, thank you so much, Hilary. So much to discuss there that hopefully we'll get on to talk about in the Q&A afterwards. We've now got 2 responses to what Simon and Hilary have said. So I'm going to welcome, first of all, Sophie Harmon and then Dan Corrie. Just to introduce Sophie, many of you will know Sophie because, of course, she's based at Queen Mary, but Sophie is Professor of International Politics here at Queen Mary. She's done a huge amount of work during the COVID crisis, particularly looking at issues concerning gender and COVID-19. She's been involved in the setting up of a new working group through the UN and has done an enormous amount of work on policy briefings with governments around the world. So I think Sophie will have some really interesting reflections on what we've heard so far. Sophie, over to you.
Thanks so much, Patrick, and thank you for inviting me to read the book and contribute to this discussion. So firstly, congratulations on the book. No one's held it up, so I'm going to hold up my copy with, marked down pages to prove it's been read. I really enjoyed this book. It silenced some cynicism I had for books that are being published on COVID-19. It was brilliant, so congratulations. And I think what I really enjoyed about it was really refreshing to have a diagnosis of the problem and to go beyond this rhetoric of build back better. So people who've worked in humanitarian crises and global health have heard this a lot. But it was really great in that it showed what could be done, what should be done, and why it's entirely possible. And I think this is why you have these sort of endorsements on the front cover saying everyone should read it. Everyone should read it. And that's obviously the real USP of the book. But for me, as someone who works in global health politics, I think I enjoyed, which seems like a perverse word when talking about health and pandemics, really mapping the trends from history that we still see today and realizing actually not much has changed when health emergencies happen. So hopefully not much changes when we think about the world and how we respond to it. And I just wanted to draw out one real example that really spoke to me, which is this idea of the searchers of the dead, the essential workers of 1578. And these were predominantly elderly women that would go door to door to work out if a death was a consequence of the plague or something else. Now, this happens today, so these trends continue. Most healthcare workers in the world are women, and most of the ones doing the insecure, low-paid jobs of going door to door are women. And we see this from people who've done home-based care within the HIV and AIDS response, predominantly in sub-Saharan Africa, the grandmothers that were looking after those vulnerable from the AIDS response, orphans, again, come into this, or immunization teams that were working on polio vaccination campaigns in very insecure settings, or women. But what particularly struck me was a conversation that I'd had at the start of 2020 when I was actually in Freetown in Sierra Leone, looking at what happens after you have a health emergency. So what happened in this country after Ebola? And someone was working for the World Health Organization in Sierra Leone, and they were telling me about all these great data and surveillance systems they'd set up to detect outbreaks and respond and all this kind of stuff that happens. And I was sort of asking, well, who actually plugs the data in the system? Who's going and counting and going and investigating these outbreaks? And surprise, surprise, it was women. And it was elderly women. It was the searchers of the dead. And they weren't getting paid anything. So I said, well, what do you pay them? You know, we have this huge juggernaut of global health security, which millions has gone to, particularly in countries like Sierra Leone. I was like, so what do you pay them? Oh, no, they just do it for the beauty of holding an iPad. I was like, right, well, I'm sure they'd also quite like to be paid. And so this example is just one of many that I could draw on from the book that just shows that not much has really changed. And I think that's what I particularly enjoyed. The other second part of the book that I'd really like to flag, which is a particular strength that often gets overlooked, is it shines light on the work and importance of local government and local authorities from the poor laws to the contemporary period as well. I've been really struck with the lessons learned reports that I've read or analysis of the COVID-19 response in the UK at how local authorities are often missing in understanding that. Now, local authorities, you know, they're not perfect, but here we saw them stepping up massively in response to the outbreak. And I think we would have been in an even worse position in the COVID-19 response had it not been for local authorities, their kind of death management campaigns, that's wrong, their death management teams, their coordination of adult social care and the vulnerable. And this was happening, as the book quite rightly sets out, in the context of a decade of huge cuts and austerity and a real shambolic communications coming from central government as well. I mean, personal note here, this was happening on the kitchen table for my partner, who was sort of managing some of these aspects in a local authority. But I think what was really important is it shows the importance of the non-health sector in response to health emergencies and pandemics, and also the role of local authorities in welfare as well. And what showed as well what they can do when you turn the taps on after years of the taps being turned off as well. What's concerning then for me is that the local authorities don't really come into any future pandemic preparedness or response planning going forward. They weren't there before and they're not there now. And this is huge, it's such a huge gap. We've had several gaps we've seen in the pandemic response. So the first thing, if you have an emergency outbreak, the things you do is firstly contact tracing, so track and trace, that's the first thing you do. Second thing you do is you protect your frontline health and care workers, most basic. And the third thing you do is you engage local authorities and community leaders to get the message out there and coordinate the response. I think we have recognition on the first two, but the third one I think is still missing in our pandemic preparedness. So given this insight is really concerning, it's overlooked, and therefore I'm really pleased to actually finally read something that mentions local authorities, so excellent. Anyway, as an academic, perhaps I'm being a bit too praiseworthy. So my only critical comment really, and this is just because you have to say something interesting, I really love the book, is perhaps there's a 8th pillar that is missing. And I hate to do this because you've written this book, you've got 7 pillars. You don't want an 8th pillar, otherwise you would have put it in. And that's really global solidarity in international relations. And I really understand that obviously the emphasis of the book is to look at our own history in the UK, to think about the future and what has been possible and what is possible. But our history is global history, and global politics is really vital for understanding both what went wrong and how we build back better, and our role in the international community. So 2 very quick comments on this before I wrap up. The first is the diagnosis of what went wrong in the UK's COVID response. And I think, as Hilary outlined, the diagnosis is spot on, right? There is also a clear global element in the book of looking the other way around Brexit too, and not taking the findings of Cygnus seriously, or warnings around global health security and health emergencies. And this isn't even in things that were released in freedom of information. This was just in the UK's security strategy that you could just go and look up online. It was there, big flagging risk, influenza pandemic, also antimicrobial resistance. They were the 2 big threats to the UK, and they have been since the David Cameron government. So it's all there in the documents. What's really telling when you look at this, and this has been very interesting for me as someone who works in global health politics, the UK government is one of the biggest funders of the World Health Organization. It's one of the biggest leaders in global health across various kind of public-private partnerships, from the Gavi Alliance, the Vaccine Alliance, to the Global Fund for AIDS, Tuberculosis, Malaria. And also we have loads of health experts. We export them. When there's a health emergency, we could call up London School of Hygiene and Tropical Medicine, or Imperial, or Cambridge, or wherever. And these are the people that go across. So what went wrong fundamentally? And if you look at these reports, real problem is that these threats have been framed as something that happens out there. The threat is out there in the world. The threat is not internal. We're fine. We've got the NHS. So you've always got to be scanning the horizon out there. I mean, that is hugely arrogant and complacent. We can also, my students are very kind of anti-racist, decolonial, and they would sort of like ping, ping, ping. Why is it that we always think that these things emerge in Africa or Asia? Why can't they see that Europe is the crisis? And this is the real couldn't happen here problem. There's a real, it couldn't happen here, it will never happen here problem. And again, this is a concern that's going forward. If you look at the pandemic preparedness plans, it's again externalizing the threat. The threat is out there, the threat is not here. And the threat is very much internal. And I think that's what's really brought to bear both in our experiences of the pandemic in the UK and from this terrific book as well. So that's the first thing of why I think the international really matters there. The second point is that it's vital because international relations and foreign policy is so often something that UK politicians enjoy once they're elected in positions of power, being on the world stage, going to the G20, being at the UN Security Council. But it's often seen as an afterthought in how it joins up with policy and strategy domestically. And I think this is really wrong. I mean, the biggest concern in the world should not just be about the next pandemic or health emergency, again, hello, antimicrobial resistance, but getting equitable access to vaccines. It's a notion now that, we're good after the virus. I know that's not what the authors are arguing, but we're good. We've got our booster jabs. We have vaccine passports. Everything can get back to normal. And no, this is fundamentally not good enough. Firstly, on a moral, ethical, collective, individual kind of idea, that if we have the vaccines against a deadly virus, we should make them accessible to all. If that doesn't, do enough justice to the argument, there's just the idea of global health security and that idiom I'm sure you've all bored of hearing, that no one's safe until we're all safe. Until we vaccinate the world, this is never going to go away. We will never be after the virus. And this is a huge problem, and it's a problem that is a policy choice. This is a decision. It's not just something that's come about. We could vaccinate the world if we wanted to. And I'm happy to expand on that in the Q&A if people are interested. So in sum, we need the 8th pillar if we're going to build back better. We also need to build our international relations back better So perhaps that could just be your second book. I mean, well done on doing one during a pandemic, so perhaps it's a bit bold. And I think we need to think about foreign affairs as not separate or distinct to British politics, other than Brexit or Europe. It's something a bit more than that. But actually how we think about the future of our country and these ideas of solidarity and collective individualism, rather than this kind of individual status approach to global health security that's not going to really get us anywhere. We need to stop looking the other way. And then finally, obviously, the idea of audience is that everyone's going to read this book, but then who's going to take it on? Who's going to be Elizabeth I? Who's going to be Beveridge? Who's actually going to take these ideas and run with them? So yeah, I hope that one of the participants in the audience is going to do it. Thank you so much.
Brilliant, thank you, Sophie. And I think so much there, again, to talk about, I think this point you make about the indisputable link between the domestic and the international in relation to health policy, something we should come back to in the discussion. I also love it whenever somebody responds to a book and says, go and write another book. I'm sure Simon and Hilary will be going away tonight and planning, working on the next book proposal. I'm going to hand right over to Dan Corrie. Dan is former advisor, former head of the policy unit under Gordon Brown, special advisor in the Labour governments after 1997, now chief executive of New Philanthropy Capital. Dan, over to you for your response to the book.
Thanks a lot, Patrick. It's great to be here. Hi, everybody. And just to amplify what Patrick said, so I come as an economist, a former policy maker, and now pretty steeped in civil society, and especially the charity and philanthropy sector. So a lot of biases there, and interpret everything I say with those biases that I bring. I'm going to talk a little bit about the kind of big hypothesis, to some extent what Simon was talking about, and then a bit about, and particularly about, the sort of social sector and civic society, which is a theme in the book as well. I mean, first, to echo what Sophie said, it's a really good read. Not surprising, there's some very serious analysis. These are serious people, but they're also very good writers. And the bringing together of historical perspective with current political and economic analysis really works. So I really enjoyed it. And I'm sympathetic, of course, to most of it. And I slightly worry, of course, maybe that's what Sophie was hinting at, that only those who already would kind of agree with what it says will actually read it. That's always the old problem. But maybe if it gives those of us who do agree with it more confidence and more energy and more arguments, then that's a good thing, even if what we really want is all the doubters to read it. I mean, the big hypothesis, as Simon kind of outlined, is that we do better as an economy and a society when we have an underpinning state that looks after us all. And obviously, there's a lot of talk about the Elizabethan Poor Law. I don't know if that's accepted truth. Simon would know better than me, but I'm sure, like everything in history, there's some contests going on. Some of what Simon said, the old economist in me kept saying, hang on, that's correlation, not causation, et cetera, et cetera. But nevertheless, the concept of collectivist individualism is very interesting. And then, of course, talking later about the sort of post-war Attlee changes and the problems of neoliberalism. And it seems to me that's a very important line of argument. The idea that a welfare state that is inclusive and nurturing leads to better outcomes for virtually everyone is something that does need restating. And it's really important to do that in a historical context. And in a funny sort of way, I think it may be, in terms of, if you like, British politics, it's more persuasive that it's our history that tells us that, rather than looking over to Germany. They have this welfare state and they seem to do better than us. Let's be like Germany. Maybe, Elizabeth is the key thing. I mean, completely coincidentally, I was at the British Library exhibition of the letters between Elizabeth and Mary Queen of Scots. Sadly, they didn't seem to write to each other about this, or maybe I was just looking at the wrong letters. I mean, I do have some concerns. I mean, it does feel like the argument sort of misses out some of the reasons that these systems have broken down or have had problems. I mean, arguments about government failure, inability to deliver, and so forth. I mean, these are real issues, which one can't completely dismiss. I felt the book, when I kind of like that bias, but nevertheless, it's very optimistic about human nature, underplays, I feel at times, the role of incentives, particularly financial incentives, and so on. And certainly, I mean, in my time at government, at least, I think I felt at least that we were trying to always get the balance right in different policies, for instance, in welfare, between supporting people because it's good for people and good for the economy, and giving the right incentives, for instance, to be active in labour market search and activity. And that's, one is always trying to do those two sorts of things. And you can't just say that, one of them really doesn't matter, in my view. But if we accept the argument, then how on earth do we get there to this different world? And the book sort of says, and I'm quoting, "We, the citizens, need to vote for an empowering state." And it says we want to have, and again I'm quoting, "not a disempowering state that has systematically worked to weaken the many forms of civil organizations, local representative government, employee representation and protection." And of course, I agree with all that, but my observation is people keep not voting for that certainly over the last dozen years. So we do have an issue. And although most of the proposals, the 7, maybe there should be 8 principles at the end forward, are not really that radical, I still don't really see that much appetite for them at present. And Hilary, as a good economist, made very good points about spending and so forth. But there is a real issue. I think less about the kind of the debt and the deficits at the moment, but the fact that spending on health, social care, pensions, and so on is eating up an increasing percentage of whatever it is that any government thinks that can be spent on public spending, and that is a real constraint, and we can't just kind of ignore that. The kind of book hopes that COVID and I think the climate crisis as well are the big moments that mean we can have a change. And again, to quote something from the book, says major shocks and crises are often the catalyst for a re-evaluation of the social contract, which is true. But I mean, is that likely, and how can we make it more likely? And is it true that COVID has changed things a lot, or in a sense, are we going to go, back to the status quo? All the things that were there before that pulled us to that kind of status quo will still be there. I mean, it's certainly true that we were very unprepared for COVID, and I think the book brilliantly tells the story. And indeed, it is a very pitiful and troubling one. And I think it's really important to have it all written down in this sort of way. And I hope when we ever have the inquiry, this will be a very good source for it. Austerity, as Hilary talked about, has been a root of a lot of the problems we had. Welfare cuts, inequity widening, the way we do procurement and outsourcing, cronyism, the excessive power of finance and financial sector, the lack of regulation of firms and their constant push for short-term profits and paying dividends and so on, the distraction of Brexit, and the lack of preparation for the eventuality of a pandemic due to the way the government has worked in recent years. All those were there. The book, for me, slightly tends to say that's all neoliberalism, and neoliberalism, we've got to get rid of that and so forth, and the power of the rational economic man. You can argue about the words. I tend to see people who use neoliberalism to capture all that stuff as simplifying too much. But I do think, there are a lot of trends in some of these areas, partly as a result of COVID. So maybe we'll see some changes there. I do think a very important change that is happening already, and with a major shift in our models, is the end of the idea that we have to run everything at maximum, if you like, efficiency with no slack, no spare capacity, whether that's the NHS, whether it's kind of logistics or whatever. And I think to some extent policymakers have got very mixed up in this kind of thing. I mean, just to give 2 examples, I remember when I worked on energy and utility policy, there was a great desire, of course, to get prices as low as possible for consumers. You don't want hardworking people having to pay more for their energy than they need to. But actually, security of supply really matters ultimately to people. They're more worried about the lights going off than anything else. And equally, I mean, it's interesting talking about previous pandemics. There was a time, Patrick might remember, where in the Labour government towards the end, when there was a big worry about the bird flu happening, and we had to make decisions about whether to spend a fortune. I think it's because the French had bought most of the vaccines, so we had to pay even more for them. And we did pay up in the end. And of course, the bird flu never came. And there was a lot of criticism. Why did you waste all that money? And I think those sort of arguments, which made people sort of not want to build in that resilience, I hope one of the things COVID will do will get rid of them. I mean, there is an argument that we are starting to see a kind of mild Tory version of these kind of changes to what the book calls the kind of neoliberal state at the moment. And just to finish off, to say a bit about the social sector, because actually the book is very strong on the role of philanthropy, particularly in the Elizabethan Poor Law era. It's absolutely fascinating stuff. I enjoyed it. But I think the idea, I might be getting all this wrong, is the Elizabethans sort of crowded in good philanthropy alongside their poor laws via the 1601 Charitable Uses Act, which was new to me. And if I understand it right, the point is that if they did more sort of philanthropy, then they were likely to have to pay less taxes for the poor in their areas. There would be less of them around, which makes some sense. I'm not sure it's the kind of the real motivation that we kind of want people to be philanthropic for, but I mean, it's always been part of the argument. But I mean, I have to say there are many that are pretty critical of that paternalist world, that kind of philanthropy, looking after the poor kind of world. And even today, philanthropy and charity have some bad connotations, even though some of the UK sector is trying to modernize and sort of get with the 21st century. But today, I would certainly argue that civil society is crucial to social capital, be that bridging or bonding, to trust, to creating a good place to live, as well as creating innovation and dealing with things that the state does not see as priorities. And of course, it also helps give people agency and motivation outside either state or market diktat. Political parties tend to keep out of this, and in a way they should, because after all, it's an independent sector. That's the whole point of it. And in a way they shouldn't, because civil society is a key part of society and a key part of helping create good lives and healthy well-being. But in recent years, both Conservatives and, if you like, Corbyn-style Labour have been very suspicious of the charity sector for rather different reasons. And I think that's a shame, because we do need a pluralist society with different voices. Equally, the charitable sector, the civil society sector, is sometimes rather strange about its relationship with the state, including at local level. And we heard Sophie talk a lot about local government. And I know from reading other stuff by Simon, which was about the big society, how he, you know, this kind of false dichotomy between you either have strong local government or you have strong civil society is a complete mistake. And in fact, civil society has been at best when local government's been strong and well funded. Both need each other. And, you know, to come to a current kind of debate at the moment, if levelling up is to work, if we ever work out what it means, then the government does need to make sure that civil society, social infrastructure is happening in places. And the work that we've done where I work at MPC suggests that of the funding announced so far, about 90% of it is for physical infrastructure. Most of it is for capital and short term and so on. So it's not going to produce those kind of things. So just to conclude, I mean, I think we definitely need the passion that's in this book, along with the analysis, to help us have any chance of moving forward, and to tell us that a naive, full-on market paradigm is not the only option or a good option, but also was not, or certainly not, obviously was not, behind the UK success in the past. And we need to push for a more decentralised approach with a supportive state and with civil society much more to the fore. I hope lots of people read the book, buy the book as well. I'm sure that'd be nice too, and that its messages do get through, and we'd be a lot better off if they did.
Well, thank you very much, Dan. And I think both Sophie and Dan have put on the table there some really important questions, which will give Hilary and Simon a chance to respond to. I mean, I think Sophie's point about who's going to take these ideas and actually turn them into reality, who's going to implement or deliver them, is clearly fundamental. And I think Dan's challenge around, is there perhaps too much optimism here about the state? Is there enough cognizance of issues around government failure and so on? Again, really important. We've also had a couple of questions come in, really interesting questions. So there's a challenge from Nico McDonald, who says, really enjoying Simon's talk, but I sense too much correlation inferring causation and a respective justification of the welfare state class. So Simon, you might want to respond to that. And then there's a question here from David Coates, which I think fits again with what really Sophie and Dan were arguing. Is there a case for an independent, dispassionate inquiry like Beveridge into the social and economic risks to which citizens are exposed today? What 5 giants need to be slain in 2021? Neither the government, as Hilary has described, nor the opposition are evincing the necessary ambition today. So it'd be great to hear your thoughts, your responses. Let's start with Simon, and then we'll go to Hilary. So Simon, over to you.
Yeah, thanks very much, and many thanks, Dan and Sophie. Really nice to have these carefully thought through responses to our work. It's very, you know, nice to be getting stuff back and hearing what people are making of it. And I would preface by saying I think this, you know, the eighth, my heart dropped when you said eighth pillar, but you know, but your point was a very well made one, that it you know, I think our book was a little bit longer than the press had hoped it would be anyway, but you know, I think keeping our limits to what one might call domestic British matters was sort of one way of containing what we had to say. But of course, you're absolutely right that particularly Britain with its enormous empire wants and being a trading nation and always has. I mean, the international dimension is central to our history and is certainly absolutely crucial to, you know, what's going. I mean, you know, if only Boris Johnson had the skills of Gordon Brown when he was dealing with the international community back in 2010, then we would have seen, I think, a significantly bigger outcome in Glasgow, for instance. But you know, you have to have somebody who really knows their stuff to do that, and that is not something Johnson's ever been guilty of. So, you know, yes, I really think that the international thing is crucial, but I think that getting our own house in order is part of that. And I think until we as a society begin to embrace collectivist individualism and begin to embrace our own heritage and our own history and actually question what's been going on for the last 40 years, we're not going to be good partners either. We need to, you know, we need to change internally as well as in negotiating with others. On the correlation causation thing, I mean, that's a sort of econometric type standard view of how the world works. As a historian, we think the world works through narrative accounts because of the complexity of forces involved are such that the econometric approach to understanding things is, quite frankly, just not going to work, not adequate. There's too much going on at all kinds of levels. So the way that we in history construct our understanding of causation is very deep, complex webs of things. And we can, of course, look across. And, you know, for instance, I think it is very telling that, you know, that England is economically nowhere in 1600. It's on the edge of Europe. It's a minor bit part player economically. There is only one big fish in town, and that's Holland. The Dutch economy is so far ahead of anybody else, it's unbelievable. You know, if anybody had offered me a bet if I was a citizen in 1601 and they said, guess what, there's going to be some incredible economy 200 years from now, like you can't believe, you know, you just said, of course, it's Holland, I'll take your money now. You know, it was so far ahead. And England actually completely keelhauls and overhauls the Dutch economy over the next 200 years. And, you know, you've got to look for what does the English economy and society have that the Dutch don't, because there is so much that both of them have, and there is so much that the Dutch have that the British don't have. But here is one thing really, really different between the two countries, which I think is, you know, something which means that we need to think about it. And one of the reasons why it's been hidden in plain sight is that we've had generations, starting with Adam Smith, continuing with the famous commissioners who abolished the Victorian Poor Law, but also including Fabian socialists, the Webbs and Tawney and others who have trashed the poor law generation after generation after generation. I mean, the old poor law, the Elizabethan one, they said, oh, it didn't work. Oh, it was rubbish. Oh, you know, it was just a ramshackle load of stuff. And it's only in the last 40 years with archival research from my colleagues, you know, 40, 50 monographs going back to, you know, absolute overseers records and things like that, which we thought, you know, we would never see. Have we disinterred? You know, it's been literally like an archaeological excavation of this amazing institution, which we'd previously written off and thought was a nothing. You know, just and that's partly why this history is new and surprising. It's not surprising to my colleagues in early modern history. They will be the one people who will say, oh, you know, what Szreter and got to offer, you know, we know all this, but they're not actually telling anybody else about it, which is a great shame. So, you know, so that's my sort of response to that. Hill, do you want to come in and say something?
Hilary, please come in.
Yeah, right, I'm unmuted. I think there was a question, should there be an independent, dispassionate inquiry into the social and economic risks that citizens face? And I think that's a really interesting idea. I mean, we have so much talk or hot air about levelling up at the moment, and sort of divergent or different views about whether that's about infrastructure and place-based inequality, or whether levelling up is actually a more general agenda around inequality. And I think that unless we have some kind of dispassionate inquiry into the risks that citizens face, then I don't think we're ever going to have the policy tools and the policy responses we actually need to genuinely level up. There is that the IFS Institute for Fiscal Studies has commissioned a review of inequality in the UK contemporarily, led by Angus Deaton, and I think that that is actually going to pick up a lot of these issues. I mean, in terms of the question, what are the 5 giants that still need to be slain? I think that some of the issues are still the same. I mean, food insecurity, I think, was one of the real shocks that came through in the pandemic. And I think the work that Marcus Rashford did on that, really brought that to public attention. But I mean, it was such a huge issue. But I think other issues now, which I think would be part of the 5 giants, are things like digital exclusion, which amplified educational inequalities during the pandemic. But clearly it must have been amplifying them before the pandemic. It's just that we weren't aware of it in the same way that we became aware of it when we saw that children couldn't even, access their lessons from home if they didn't have broadband, or they didn't have more than one mobile phone to share between siblings and so on. So I think that there are some really big issues that do need to be looked at in depth. And I think the issue of carers in our society, which are predominantly women and in many cases older women. I mean, there's obviously childcare and elder care, but a lot of that is falling on grandmothers or women in mid to late careers. And I think that that's a really hidden risk, really, that people face through their lives. So I think there's an awful lot that really needs to be analysed to really kind of work out how we genuinely level up and make sure that everyone is empowered. I mean, in terms of who's going to take this forward, I think obviously at the moment, and I think someone has also said, why are voters not voting for it? I think that we want to be part of a process of getting new ideas and new thinking, or sort of amplifying existing thinking, helping people to see that in a coherent way. I'd be particularly pleased if our audience included lots and lots of younger people. I think that the intergenerational issues that are coming forward at the moment, I mean, obviously they have their flashpoint in climate change, but there are also huge issues. There are huge issues around the concentration of wealth amongst a particular part of the demographic, the older demographic. And I think that, you can see the cost of living crisis that we're facing, the tax rises that are hitting younger working people, not the well-off, whilst we have a lot of other people who are not facing these increased taxes because, for instance, the new national insurance is not being paid on pension income only on the earnings of pensioners, but not on their actual pension income, not on the rent that people get from owning second homes and so on. I think that all of those issues will perhaps start to become more apparent, more in the consciousness of the younger generation. And, you know, it may be that this is slow and not the sort of big change, rapid change in the social contract that one might have thought would happen as a result of the pandemic, that you know, if things do seem to go back to normal. But I don't think that this situation is sustainable, that we just don't tax wealth effectively. And as Dan said, when we can see that health and social care and pensions are taking up an increasing amount of public spending, and the investment that we have to make for climate change adaptation is huge, you know, there's got to be a change. Somebody has to grasp that nettle.
Thank you very much, Hilary. Well, we've got a few minutes left. I just want to put a couple of questions that have come in actually to our respondents. So I think a question that Sophie might want to pick up on, which has come in from Zareen Fazrali, which is really about resilience. And I think Zareen's question is about whether the experience of the pandemic is likely to lead governments to take more seriously the need to build resilience into public policy decisions and thinking about policy delivery. So it'd be great if Sophie could pick up on that. And then Dan, I'm going to put your own question back to you, which has come in from Ray Shostak. So Ray's asking, why do we think that the voters don't vote for the kind of 7 or 8 principles or pillars that are set out in Hilary and Simon's book? What are the obstacles to that from a kind of electoral perspective? So thoughts from you would be great in a few minutes. Sophie, back to you on this question about resilience.
Thanks so much. Oh, I'm pleased you picked that out, because I saw Zareen's question. And I think this is a real problem that actually happens quite often in global health, that you can make an argument that a certain public health intervention is very good for people's health, and therefore it's a good in and of itself. But that never works with governments, and it doesn't work with international institutions. So you always fall back on the economic argument of, well, if you do this, or if you invest in their health, it's going to increase your GDP by this amount. And that worked for many years. And then people started to get a little bit like, ooh. And then you saw this emergence of global health security. So then it was framing these issues as, if you don't do this, this is going to be a threat to your state or society. And what's happened with those arguments is they tend to get trotted out repeatedly to justify this case, rather than what you kind of notice, a kind of revised moral argument, or that health is a good in and of itself. And I think the horse has bolted somewhat with that. And actually the pandemic has made this idea of security and health security much bigger. So you always have to justify it. And that is going to be fundamentally problematic for dealing with some of the drivers of the poor response to COVID-19 in the UK, namely the care sector. Because the care sector is not seen as a threat to security, even though you could frame it in different ways, you're always going to see a focus shift towards these kind of big threats of pandemics, AMR, things like that, rather than doing the kind of what we call in global health, the bread and butter health system stuff. So if you ever actually want to stop pandemics or health threats, just invest in health systems. It's just like one of the easiest things you can do, but that's not how global health is financed. It's financed all around security, because that is how you sell it to states. And this has been a huge problem. I mean, I'm sure you follow all the debates on global health, but this has been a massive problem since around 2000, the late 1990s. And it continues today. And I think it's going to actually get worse, unfortunately. And that's going to create wider problems down the line.
Okay, slightly downbeat note.
Sorry, yeah.
I'm sure downbeat but realistic, so that's important. Right, Dan, tough question to put back to you, but what are your thoughts about the electoral politics around all of this?
I mean, it's difficult. You know, obviously I've been, involved with some of my career in the mucky world of trying to win elections and stuff like that, and trying to work out, how, what inspires the people who need to vote for you, which are often the floating voters, to come on board, and there was an attempt from the left that if you have a sort of Corbynite thing, very radical, very noisy, very inspiring, that somehow you win elections, and that clearly didn't work. And so I think, you have to meet the public a bit where they are. I think attitudes have changed as a result of COVID. I mean, interestingly, I think the debate next time, you could see, I mean, Hilary was referring back to the Sunak budget, and he's desperately trying to get back to a next election divide between usual kind of divide. Labour would spend too much and debt would go up and we won't. But in fact, because he is spending an awful lot, it was a very strange budget speech when, as Hilary said, he announces the sort of biggest spending, the biggest taxes for decades, and then says, but I'm actually a small state conservative, a very, very peculiar. So it may well be that divide is much harder, and the debate we get next time, which I think will be healthy, whoever wins in a way, is much more about how we spend and what we should spend it on, not, you know, the total amount of spend. But and we've got a strange world of politics at the minute. I mean, the Conservative Party is now a coalition that they can't quite work out how to work out with the, if you like, the sort of caricature, at least, of the Red Wall as socially conservative, but wanting a lot of state and spending and so forth. I mean, these are not people, if you like, whose kids go to private school, have 3 cars, and some of them, will depend at some point on welfare. And so it's a very different coalition for the Conservatives to try and negotiate. Labour's got its own problems, which are kind of a bit more familiar, keeping the sort of the metropolitan liberal class and the sort of northern working class coalition together. So how it will play out, I don't know. I mean, I think you are seeing, Johnson is a populist. I think the populism in politics has been difficult for a lot of people who are on the progressive wing of politics. And I don't know whether that's going to last. Boris Johnson hasn't had the easiest of weeks. So that mentioned, I'm always an optimist. I think it will happen, but I don't think it's going to happen quickly. But I do think, I mean, this is where I totally do agree with the book, and the implication of COVID is that we do have a chance that we haven't had for a long time, or certainly to break out of what we've had over the last 12 years and austerity. It seems like nobody seems to have owned austerity anymore. So nobody talks proudly about it. That's good. So we do have a chance, but I'm always, I guess it's because I'm an economist, so I see the incentives that make people behave in certain ways that we wish they didn't. Have they all gone away because we had COVID? Probably not. We may well, as quick as people could, they want to go out and consume again and spend loads of money and not save, and we don't have enough investment. That's a sort of British problem. I'm not sure it'll go away. So I'm optimistic, but it's it's difficult.
Okay, thank you, Dan. So Simon, Hilary, we've got 1 minute left. Here's a question for you. How optimistic are you that a decade from now, the main ideas in your book will be seriously influencing the government's public policy agenda in the UK? Simon.
Well, I think one can put a strong bet on the pillar of sustainability. I mean, no government, it's Canute to try to resist that one. And I think that is the thin end of a wedge that brings all the other pillars in behind it. I think that's the bridgehead. It's the one that people cannot, no matter how conservative or neoliberal their politics, they cannot resist this. It's an unstoppable issue. And it's a little bit like what Dan says. The question is, how do we spend? And I think the imperative of sustainability is going to force some of the serious consideration of the other pillars in behind it. But we'll have to argue it every step of the way, those who believe in these principles. Sorry, Hill, over to you.
How optimistic? I'm cautiously optimistic. I mean, as I say, I do feel that we've got to the point where the status quo is not something that people are going to just keep on accepting. I think there will be a reaction against the long-term effect of austerity, and the cutting. I know it's a temporary increase in universal credit, but to cut that back and the impact that's had, the rising child poverty. I just think that there's enough forces building of resentment and understanding of the divides and the unfairnesses that I do think that new ideas and you know, a push for a change will come through.
But we've got to get this through to our politicians. I mean, Labour obviously is the big story, but they need to, I do think Labour has to look very seriously about how serious they are about not having another small, slim Conservative majority at the next election. And if they're really serious about that, they've got to start talking to the Liberal Democrats and the Greens, because I think anything else is making it easy for the Conservatives to come back with. I think they'll get a much reduced majority at the next time. Maybe, you know, if they really mess up over the next 2 years, maybe they will even lose that majority because of a flip in the red wall area. But I would like to see Labour really, I mean, obviously I wouldn't like to see, because it would have to be secret and confidential. I would like to think that Labour are talking very seriously to the Liberal Democrats and the Greens, because we have to, you know, for any of these ideas to stand a serious chance, I cannot see a Conservative government putting them through.
Okay, well, lots of food for thought there. We better leave it, but I just want to say a big thanks to all of our speakers for being with us this evening for what I thought was a, you know, really fascinating discussion around Hilary and Simon's book. It would be remiss of me not to mention that MEI webinar attendees can purchase the book from Cambridge University Press for a discounted price of £9.99, which seems to be very reasonable. And of course, Christmas is coming. So those of you who are thinking of Christmas presents for friends and family, you couldn't do any better than a copy of After the Virus. So the discount code is after MEI 21, which I think Sophia will put in the chat. You can find out more about Mile End Institute events via our website, sign up to our mailing list. But I just want to say thank you so much again to Sophie, Dan, and of course Simon and Hilary for speaking to us. It's been a great discussion, and one that we hope to follow up in future events. So have a great evening, everybody. Great to see you.
Thank you, Patrick.
Thanks.